Welcome to my channel, where I share lesser-known remote job opportunities for medical graduates, especially for housewives who want to work from home. If you have a medical background but can't work full-time in a hospital or clinic, this space is for you. Here, I'll guide you through remote medical careers, non-clinical healthcare jobs, medical interpretation, medical writing and translation, flexible income opportunities. You can start from home. You don't have to give up your degree. You just need to use it differently. If you're new to medical interpretation or confused between different interpreting styles, this video will clear it all up in a very simple way. What is medical interpretation? Medical interpretation is real-time communication between a doctor and a patient who don't share the same language. The interpreter's role is to accurately convey what is said, without adding or removing anything. If you have not seen my medical interpreter video, check the description for the first video. Today we will discuss types of interpreter. There are different types of interpretation: simultaneous, consecutive, and sight. Simultaneous interpretation. In this type, the interpreter listens and speaks at the same time, without waiting for the speaker to pause. This method is commonly used in conferences, international meetings, or webinars, where speakers speak continuously. In medical settings, simultaneous interpretation is rarely used, because doctors and patients usually speak in short exchanges, not long speeches. Now, let's talk about consecutive interpretation, which is the most commonly used method in hospitals. Here, the doctor speaks a sentence and pauses. Then the interpreter translates it for the patient. The patient responds, and the interpreter translates it back to the doctor. This back and forth is exactly how most medical consultations work.
Doctor asked the patient,
"Can you tell me where the pain is and how long you've had it?"
Medical interpreter informs the patient in Hindi. क्या आप बता सकते हैं कि दर्द कहाँ है और आपको यह कब से हो रहा है?
Patient to interpreter, मुझे पिछले 3 दिनों से सीने में दर्द है और सांस लेने में तकलीफ हो रही है.
Medical interpreter to doctor in English. He says he has been experiencing chest pain for the last 3 days along with difficulty breathing.
Consecutive interpretation. It is used in hospitals, clinics, telehealth services, and medical tourism setups. It's clearer, safer, and reduces chances of misunderstanding, which is critical in healthcare. Most beginners start with consecutive interpretation because it's easier to learn. You get time to think before speaking. Accuracy matters more than speed. It's the industry's standard for medical calls. Simultaneous interpretation requires advanced listening and speaking skills and usually comes later with experience. So remember, not all medical interpretation works the same way. For medical interpretation, consecutive mode is the foundation, especially for beginners.